Hello, this is Harry Hobson, President and CEO of Plymouth Harbor, and this is June 15th, 2020. And I'm being joined here remotely by Karen Novak, our Administrator of Strategic Healthcare Initiatives, AKA our point person for infection control. Hello, Karen.
Hey, Harry, welcome. It's good to see you.
Yeah,
It's been a
you're
busy
in your
week.
office, and I'm kind of in my home office, a little bit outside of Sarasota right now. So good to be here, and I'm glad we're doing this update together.
No,
And as we were saying a few minutes ago, I know we may have a full agenda here, so why don't we go ahead and get started? What I'd like to do is talk a little bit about COVID-19 update. And I know you've got some things that frequently asked questions that you're getting. We'll also go into the visitation that opened up externally today, again, June 15th. So I was doing my homework earlier this morning as far as the state is concerned, and I see that we're certainly approaching 13,000 COVID cases in Florida, and about 5.4% of folks that are being tested are showing up positive.
Harry, over the weekend, we had 2,000 cases per day that came back positive. And I think we're starting to see that eagerness of returning back to what was called normal before, but we've still got this intense, deadly virus that's out there and that we have no way truly of addressing how to manage it.
And,
Other
you know,
than social distancing and wearing your mask and keeping your hands nice and clean.
absolutely. I know you and I were talking offline that as we walk around, Sarasota, as we drive around, it's somewhat frightening because I'm seeing just too many people that are just not complying with social distancing. And that has to contribute to this.
Oh, it scares me terribly. I mean, when we think about how bad this second wave is going to be, it'll come back with a little bit more intensity than the first time. But again, we are still almost a whole year away from something coming like a vaccine. We may have something that might trigger addressing some of the symptoms, treating it, but not really managing the vaccine. I do know that in Houston, they're actually in their second round of clinical trials looking at people and seeing how they're responding to quote unquote the treatment rather than the vaccination. But it's just so far off right now that we need to really stay focused on that goal of keeping us safe and putting those masks on and staying that physical distance of 6 foot from each other.
Oh, absolutely. Absolutely. Karen, I know that I'll call them under frequently asked questions, but that we'll get to that in a moment on visitation. But our resident health committee brought forward a few questions, and I know you value their judgment and input. I would like to go through a couple of those things.
Sure. I think there were a couple of questions that came up regarding COVID. There were also some other things that we can maybe talk after we discuss COVID. But residents wanted to know about COVID testing, and you are more than welcome at any point in time to come on down to home care. We will bill Medicare or your insurance, and we can do a COVID-19 test on you at any point in time that you want. There's also some questions about doing antibody testing. And although it's not really a state initiative right now to look at antibodies, and some of the tests aren't quite as accurate as I'd like them to be, we're still seeing a lot of false positives with antibodies. And, sometimes that's really great to think, oh my gosh, I've got antibodies built up against this virus. And in reality, you don't. And you go out there and you expose yourself and maybe get sicker. But if indeed you want to have an antibody test done, you can talk with your primary care physician. We can get the order, and that we can actually do the actual testing here at home care for you. But we do need that doctor's order.
Okay. Okay. Very good. Karen, if we switch gears for a minute and go to visitation, what I'd like to make sure all the residents are aware I did put together a splash earlier this morning, and they should have it in their mailboxes. I know we also send a link to those many residents that have email addresses. What I wanted to do, and it's dated today, June 15th, is just go back through one more time the important guidelines for independent living resident visitations at Plymouth Harbor. And in this splash, I talk about that we were successful last week. And I think we were so pleased with that.
Absolutely. Everybody did a wonderful job with that, keeping us safe, managing the social distance outside as well as the masks. So thank you.
So we felt we were ready to move ahead. We kind of tossed our head back and forth a little bit over the weekend, watching those numbers here in Florida increase. But at the end of the day, we said, look, our residents have been diligent. They've been following the guidelines. We were successful last week, and we're going to go ahead and move in to phase 2, as I said, effective today, where we're opening visitations internally for independent living residents. Now, the success of this is going to be full compliance with those guidelines. And we know those guidelines, and I'll just summarize very quickly, but those include visitors must utilize hand hygiene and alcohol sanitizer prior to screening. So that implies everybody will be screened. Mask will always, let me emphasize, always be worn during the visit. Should a visitor not have a mask, we'll supply one to them at the screening point. Please, 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 social distancing, 6 feet space between resident and visitors always has to be maintained. And groups of visitors and residents really should not exceed 10. There's 3 more. If our visitors are bringing pets, they must always be kept on a leash and stay with the party. Now, we've got, it goes a little bit beyond safety services. They'll be monitoring this compliance continually. And our visitation hours will be 7 days a week, 8 a.m. to 7 p.m. And we have a lot of faith that we're going to be diligent in this process. Excuse me. Now, if we reach a situation where we just are not having full compliance, I'm just going to be left with no alternative but to take a step back from phase 1 until we can reevaluate how we can proceed back to phase 2. Again, our decisions are going to be based on our residents' safety and well-being. So, Karen, you've received some questions about visitations. You want to talk a little bit about those?
Sure. You know, in phase 2 of the government order, as well as phase 2 of our opening here at Plymouth Harbor, some of the questions have been about travel. If someone's traveling to Plymouth Harbor, are we going to let them in? Non-essential travel has now been deemed okay in the state of Florida. So if we have someone coming in through an airport, domestic travel, and I must say domestic travel only, is allowed if they've been practicing the social distance as well as wearing their masks at all time. And that's through an airport, on the airplane, doing what they need to do to stay safe. Now, if it's international travel, you're not going to be allowed to come into Plymouth Harbor. There are just too many variables still with international travel. If you come in from a cruise like yesterday or the last 14 days, we're not going to let you in without that 14-day isolation period, as well as traveling on a riverboat. We're going to get you to isolate for 14 days. But that domestic travel now is okay. But again, you've got to be able to answer those questions when you come through the screening. And that's, again, physical distance, that 6-foot perimeter, and wearing your mask at all times. Really important for the safety and well-being of our residents. And Harry, we stress that so much, but that is so important to us to keep you safe Our numbers are low at the hospital, and we don't want, like I said last week, Plymouth Harbor to escalate those numbers up.
And I know you're going to be watching those numbers you mentioned as part of your monitoring this week as well.
Absolutely, especially since we're opening up so much. And if those numbers start to go up, you know what, we're going to pull back. And again, it's for the safety and well-being. And I know it's going to really ruffle feathers sometimes, but you know what? That's our job, is to keep everybody safe.
Karen, you received a couple questions from residents, I know, related to maybe some of their vendors specifically.
Correct. And again, we had some questions about painters, drivers, housekeepers. They are all welcome to come into Plymouth Harbor, again, as long as they pass that screening test. So know that they will be asked about that. They will don their armband just like you and I do every day, and wear their masks. And they too are expected to be socially distant, even up in your apartment.
Okay, good, good. Anything else on visitation from your standpoint?
Let's just make it work, but we're going to need everybody's help.
We really will. Before we got on this call this morning, I did ask Summer Wrench, our director of wellness, is there anything she wanted me to pass on this morning? And as you know, they're active down there. I know on an appointment basis, we had some residents as early as, I think, 6 or 7 this morning in the pool. I'm aware of one resident who said she had a great swim earlier this morning as well. So I'm happy for that. What Summer wanted me to remind everyone, a couple of things. First of all, we're in phase 1 of opening our wellness center, and that specifically includes the bocce ball court, the outdoor pool, the kayak loan program, the art studio, and the wood shop. And as you said before, that's almost really, most of those are outdoor activities. The other thing she wanted me to be sure and remind you is that there's a new reservation system in process. And I know that there's 4 different ways folks can reserve time in one of those activities, if you will. There was a flyer put in everybody's mailbox, I believe, last Thursday, which tells you exactly what those 4 opportunities are as far as making reservations. And then if all else fails, just drop down to the wellness center. Just inside the door to the left is the alcove area, and there'll be somebody there that would love to take your reservation. So, but she's very pleased. And I know we are, and so happy for last week that everybody complied and was able to help us launch into phase 2 of visitation. Now, in time, we'll be able to open visitation for the Smith Care Center, for the assisted living, and the various neighborhoods as well. But not yet, and that comes from ACA. Will give us direction on that.
Absolutely. There are strict no visitation policies still in effect.
Right. Okay.
Mary Ann did want to add her little 2 cents before I forget about the openings and reservations. Kind of triggered it, is that the colony rooms will now be open, but she asked that you give her 24 hours, a lead-in time if this is something that you want to reserve, as well as the other rooms too.
Okay. Very good. Very good. Okay, Karen, if there's nothing else here, I know you always like to close out with something.
Got a couple things. First, from the health committee about flu vaccines. We are indeed going to be having the flu vaccine given here at Plymouth Harbor. Normally it's between September, October time. We're going to be doing that again this year. It'll be the quadrivalent, which is the 4 most common strains of the flu virus from last year, all kind of meshed together into a vaccine. It's the high dose, which is recommended for ages 65 and older. We'll bill through Medicare, so you don't have to worry about that. We will also be putting out a frequent asked question sheet that does come out from the CDC so that you'll have a little bit of information about that prior to getting the flu vaccine. But there's also been some questions about the Pneumovax coming from the health committee. But I need your help. I need to know what you need to know about it. I'm glad to put together a frequent asked question sheet, but I really need to know what you want to know about it. And then I can provide that information and get it to you.
Okay. All right.
Good
Very
thing.
good. A lot of good information this morning.
We appreciate all that the health committee does and bringing those questions forward on behalf of the residents. But you're right, it's time to close out. So we want to remind everybody in a time where it's ever so important to keep that social distance, that physical distance of 6 foot, have that around you at all times. Please remember to wash your hands, hit those high contact areas now more than ever, because we've got a number of different people coming through our environment, and be sure to wear your masks. Of everything, this is really, really important to help prevent that spread of infection.
Okay, Karen. Well, we're at the end of this video, and you know what that means. It actually means two things. I promise to put my mask on as soon as I leave the house here today, but it's time for you to don your mask.